In 2005, Mike was diagnosed with a brain tumor. We had 8 years of clean scans, and in 2012, we were told it was back again. He had that tumor removed, and in 2014, we were told it was back again. Our options were limited. Hospice was brought to our attention. But hospice seemed end of life. I knew that, and I wasn't ready. I was still fighting. But Megan, our daughter, went out to tour some various hospice facilities and came back and said, "It has to be Weedham House, Mom. It's unbelievable." And as we came in on that Tuesday, everybody embraced us.
I was the one who admitted Mike. When Mike was here, his entire journey in hospice, Linda was here all day, all night.
Mike had a trach and a feeding tube. So his care was complicated.
She had a lot of worries. I told her, we will worry about unclogging this J tube. We will worry about giving Mike his meds and his food, and those should be the least of your worries.
Weedham provides 24/7 care to relieve the family of the burden of caregiving, so that instead of being the caregiver and the family member, you can just be the daughter or the son or the spouse and be present in a different way. Our overall goal is to provide comfort, understanding the total person, understanding their spiritual side, their emotional side, their medical side, and the family, and holding all those pieces together to provide the best care that we can.
They understood the emotional piece. They understood, even though we were in hospice per se, I wasn't there yet. I wasn't ready to let go. I had to let go. I had to get to that place. I couldn't imagine being anywhere else but Weedham for that to happen. The support, the care, the love.
Between Linda being very supportive of Mike in his process of dying and having the son and the daughter here, we got to know them very, very well. And it was really long-lasting impression that they left on us.
We are a family business. We're a very close family, as a lot of families are. Weedham embraced us, the three of us. As we were preparing ourselves to let go, they helped us. They helped us in a huge way. I soon learned that the stained glass dragonfly hanging outside of a room was a sign that there was a family member actively dying, and that it was to be peaceful and quiet and respect that family. The staff had told us that Mike was close when the dragonfly was hanging outside of our room. I didn't know a lot about the dragonfly until we got to Weedham. And the story was amazing because it was also freeing and liberating. That once the dragonfly flew away, it couldn't get back to tell its family and its loved ones how beautiful the world was. That's how I had to approach this, that once Mike received his wings, he was always going to be with us, and his world was going to be so much better.
One of our tradition here at Weedham as well is we have this dragonfly quilt that we put on top of them, and then staff procession goes with the procession out to the lobby and outdoor to the car actually. And then at the same time we have our memorial playlist that's playing while the body is processioning out.
The times that I've been able to witness and participate in the quilting when a patient dies has been an incredible and a deeply moving experience, not only for the family but for myself. Every patient leaves the same. Every patient is given the same honor and respect as the other.
Walking out our patient, my patient, and their last walk out in here is my way of letting go too. It's different happiness for me, actually. I know some people find it weird, but it is. It's something that I couldn't explain. I don't know, but it's a very dignified way, and I'm so grateful that Weedom has those traditions. We care our patient in here with dignity, even to their last walk out of our building.
Weedom treats every individual equally. It doesn't matter if you're the President of the United States or if you're someone that was found on the side of a street that's taken in by the Compassion Fund. We are all part of a big cycle of living and dying, and that in the same way that there is celebration in birth, there should be a time and an opportunity for families to look at death. And yes, there's grief, and yes, there's sorrow, and yes, there's mourning, but with it there comes dignity. And that's what I believe Weedom and the hospice program provides.
Mike spent his lifetime working hard for foster care and finding kids homes because we believe that every child deserves a loving home. Weedom serves that purpose for so many people. And whether you have the ability to pay for it or not, everybody deserves a chance at a place like Weedom.